Hello, everyone. Welcome to Faculty Spotlights for the College of Professional Psychology at the Chicago School. I'm Lance Garrison, Dean of the College, and I am joined today by Dr. Sue Bay, Clinical Psychology faculty member in Chicago. Welcome, Dr. Bay.
Thank you. It's so nice to be here. Thank you so much.
Dr. Bay, could you start by telling us a little bit about your background and how you ended up becoming a faculty member for the clinical psychology
Yeah,
program there?
yeah, sure. So the way I came to Chicago was when I went to graduate school at the University of Chicago. And before then, I was in some other places like New York and California doing my studies. But I'm actually originally from South Korea, and I
Okay.
came here when I was a teenager, and then I came here to go to school. So at this point, I've lived in Chicago the longest. And then after I graduated from University of Chicago, I've always been interested in teaching. And one of my mentors who used to teach as an adjunct professor at ISPP, the Illinois
Mhm.
School of Professional Psychology, he connected me to ISPP, and that's how I started.
Oh,
And then I taught there for many years. And then when we closed, I was fortunate enough to transfer to the Chicago School. So I've been there for about a little over 5 years now.
oh, well, we're happy you're here for sure.
Thank you. Yeah, it's been really great.
In terms of your teaching or your research or your clinical experience, what are you most passionate about these days?
Yeah. Right now, well, I've always been a CBT
Hmm.
therapist, cognitive behavioral therapy. That has been my interest. So I continue to be really interested in that. I love teaching culturally responsive cognitive behavioral therapy. Um, uh, Most people think that because CBT is based in evidence,
Hmm.
CBT is more known to be evidence-based, that they think that it could be used widely across different cultures or different for different communities. But really, CBT also needs to be contextualized as well. So I love teaching about that.
Yeah,
And these days, a lot of students that we have are actually very interested in CBT for a variety of reasons.
yeah.
Hmm.
So I know you're also pretty active in the state association in Illinois. Is that
Yes,
right?
yes, that's correct. That's also another passion of mine. I'm very interested in developing leadership in our
Yeah,
community. I don't know about you, but when I was a student, I've never been taught to advocate for our
yeah,
profession, for our clients. I just did research and clinical practice,
yep,
and that's pretty much it. No one talked to me about the importance of advocacy and thinking about the future of our profession. So
yeah,
currently, I'm very involved in IPA, Illinois Psychological Association, which is affiliated with APA, American Psychological Association. And we do a lot of things like advocating for our profession, our clients. We work with legislators to pass certain bills. It's really actually very exciting.
yeah.
For example, right now we're working on, I'm not sure if you have a clinical practice, but for me, I work with Blue Cross Blue Shield insurance company. I have not had a raise in 15 years from Blue Cross
Wow.
Blue Shield. And my colleague and I from IPA, we calculated the fee with inflation. Right now, we should be getting probably reimbursed around $350 per hour. I don't know if you know that we only get $160,
Yeah,
and that has been the case for many years. So right now, some colleagues and I were working on passing a bill where we will be able to ask for a higher rate of reimbursement. But in order for us to do that, we need a lot of support from
yeah.
legislators and so on. So recently, IPA, actually, we took about 12 of our Chicago school students also. We went on a Illinois Psychology Day, Advocacy
Yeah.
Day in our state capital and talked to lots of legislators about what we do. So that was very exciting.
Yeah, I love to hear that. And, I think most of us have a similar story. There was nothing in our programs about the role psychologists can and probably
Mhm.
should play in advocacy. And so I've been much more involved in that space over the last several years. I'm a member of the board for the Texas Psychological Association,
Oh, I didn't know
but
that.
I but I think it's such a key message to share with students because there really is this whole kind of spectrum of advocacy activities that are critical for the profession, whether we're advocating for reimbursement rates or
Mhm.
advocating for patient rights or advocating for protection of the doctoral standard in clinical psychology. It's just
Yes.
something that I'd never heard about. And now that I'm much more involved, I see the value and the importance
Mhm.
of it. So I'd love to hear that you took some of our students to
Yeah.
the state legislative days. We're doing very similar work in the Texas in
Oh, that's great.
with our PsyD program and with the Texas Psychological Association.
Yes, yes. I think our students really enjoy that.
Yeah,
But also they were very surprised how little they knew
yeah.
about advocacy and also what they could do to really help our profession and those we serve.
Hmm.
I always talk to our students about how, for example, social workers. They are really good at
Yes.
advocating not only for themselves, but for their clients.
Yeah.
And whenever I go to the state capitol with some of my colleagues, I'm just amazed how they can get their students and faculty and other
Yeah.
people together to really push forward what they want for
Yeah.
their profession. We also need to do the same.
Absolutely.
Yes.
Yeah, I think unfortunately psychologists have been way behind on the
Mm.
advocacy efforts. And like to your point, many of the other mental health professions are pretty good at it.
Yeah.
And they've been doing
Yeah.
it longer and more effectively than we have. So our
Yes.
voice is so important. And you know what I've found, and I was kind of in this position as well. I was very nervous about the advocacy piece, particularly speaking to elected officials, whether they're
Mhm.
local, county, state, or federal elected officials. But what I have found is that they very much welcome that dialogue. They want the
Yeah.
expertise that psychologists bring to help them inform legislation. And so, yeah, I love the thought of getting students more involved in sharing their voice and sharing psychological science with state legislators to help shape public policy and legislation.
Yeah, yeah, yeah. So I just finished my presidential year for the Illinois Psychological Association. And last year, I think one of the initiatives that was really important to me was to get students involved
Yeah,
because they're really the future of our profession.
100%. Yeah,
Uh, but unfortunately, a lot of our students, as you know, are so busy
yeah,
with classes, dissertation, and clinical practice and training. They really don't know a lot about what they could do. So I'm really
yeah,
interested in getting more of our students, the Chicago school students, to be more aware of what they could do and also get more involved at the state level or even national level at APA.
yeah. Love it. You know, the next question I'm going to ask you, Dr. Bay,
Mhm.
I think you're really already touched a lot on, but how do you see the work that you do as a member of the faculty having an impact on students and the community? Obviously, you know, the advocacy piece is one
Mhm.
avenue of really substantial impact, but are there some other areas where you feel like your work has a pretty strong and enduring impact?
Yeah, so advocacy is one, but the other I think is the way I teach in the classroom.
Hmm.
So I love teaching basic intervention courses, especially in CBT. And I think for our students, especially since they're very interested in becoming clinicians in the future, it's very, very important for them to actually practice a lot of their skills.
Yeah,
They get to practice in their first year in their basic intervention skills class, but then after that, they don't get a lot of opportunities to do it at school, maybe in
right.
their clinical practice. And if you think about our profession, it's very odd in that you learn how to do therapy, and then after you graduate, potentially no one else sees you doing it,
Right. Yeah.
right? No one
Yeah.
sees you how to do it, so no one potentially knows whether you're doing it right or not.
Yeah. There's no peer
Uh,
review once you
no,
graduate, right?
yeah. So there's actually some research right now that indicates that people, clinicians who graduated and who've been in the field for many years, their skills actually don't improve. In fact, they actually get worse
Yeah.
because they don't do a lot. They keep on doing the same things over and over again. So I'm really interested in working with our students in thinking about how to continue to develop their skills over
Yeah.
time by practicing. It's like playing tennis. If you
Yeah.
want to be good at tennis, you have to practice every day.
Yeah.
It's the same with skills that are necessary for psychotherapy.
Yeah. And even the best tennis players in the world still have a coach
Yeah,
watching them and
exactly.
helping them improve their technique and studying film. And
Right.
it is surprising that we don't have some sort of mechanism for that ongoing development, that lifelong learning perspective
Hmm.
with those critical skills that we bring to the room with our clients.
Right. So I always
Yeah.
encourage them to practice on their own, but also with each other, with their supervisors, with
Hmm.
their professors. And it really is a ongoing career goal to continue
Yeah.
to develop your skills. And to polish your skills and so
Yeah.
on. So that's something that I also feel very passionate about. And I think our students, hopefully, are understanding the importance of that. And that will really impact the rest of their career development.
Yeah. What do you think it is about the Chicago school? As you know, you think about your role as a faculty member, having come from a different institution. What do you think it is about the Chicago school experience that's unique or particularly valuable to students?
Yeah, I think one of the things that's really impressive, it impressed me a
Hmm.
lot when I first came on, is the diversity of interests of our faculty. You
Hmm.
probably know already,
Yeah.
and a lot of our students, new students, comment on that too, that there's a huge range of interests in our faculty, whether it's research, clinical practice, um, or community related work and so on, even theoretical orientation. I think that
Yeah.
there are people who are pursuing different kinds of modalities and interventions and so on. So there's a tremendous opportunity to learn, but also collaborate. And our faculty, in my opinion, are so collaborative and supportive of each other.
Yeah.
It's really a wonderful place to be for both faculty and students.
Yeah, and there's a theme as I meet and get to speak with faculty that's very common, and it is that kind of that diversity and kind of the inherent tension that goes with that that leads to really amazing collaboration
Mhm.
and opportunities for students. So it is an awesome part of being a
It
student.
really is. Yeah. Yeah. It's really wonderful. And I hope that they take advantage of all the opportunities that they have.
Yeah. So having been a student at one time that was looking for a clinical psychology program to go into. I know I had that experience as well. What advice would you have for someone who's maybe finishing up their bachelor's degree or their
Mhm.
master's degree and they're thinking, you know what, I might want to be a clinical psychologist?
Yeah. I think that's a really good question. And I was trying to think about when I was a student,
Hmm.
what was important to me and also what I didn't know. One of the things that I really love about being a psychologist is that I can have a diverse career.
Yeah.
So when I was a student, you either chose to be a researcher, professor, or clinician. There
Hmm.
weren't a lot of other pathways to do different things as a psychologist. But now there are so many different opportunities.
Yeah.
It's not just clinical practice or research or teaching. You can do so many different things. I have a friend and a colleague who works at the UN. After she got her PsyD, she decided to work in international relations and trauma and so on. So
Yeah.
she works for the UN. You can be a consultant, you can do research, you can teach, but you could also, even in terms of clinical practice, there's so many different
Yeah.
paths. Right. It's no longer that you are a solo practitioner in your own private practice and you see 6 to 8 clients every day.
Right.
There's so much diversity in our profession. So I really would love our students to know that you can do so many different things. Really, the
Yeah.
sky is the limit.
Yeah, I agree. I know when I was in graduate school, the vision that I had was being a psychologist in a clinic,
Hmm.
seeing clients.
Yeah,
And I could have never imagined the paths, the many paths that I've
exactly.
gone down over the
Yeah,
course of my
yeah.
career,
Hmm.
from that private practice experience to working in schools to consulting,
Hmm.
being a part of multidisciplinary medical teams.
Right.
Now, I've been a faculty member, a department chair, and now I get the beautiful privilege of being a dean for the College of Professional Psychology.
Hmm.
But I could have never imagined that there were that many opportunities. And my experience is just a really small slice of what's possible.
Hmm. Yeah, yeah. And it really helps to know from the get-go that you have so many options
Yeah,
paths, because I didn't know that. And it took me a while to get to this place. But I think for our students, it's really helpful for them to know that they
yeah,
can do so many different things as a psychologist.
yeah. Well, Dr. Bay, it's been wonderful speaking with you. Thank you for joining me.
You too. Thank you for having me. It's been great. Thank you.